Imagine your beloved dog. One day they're just a blur of pure joy, tail wagging like crazy, chasing everything.
Yeah, just full of energy.
Exactly. And then the next day, they're quiet, lethargic, maybe not interested in food, perhaps a bit sick.
Right.
And you think, okay, maybe just a little bug, but then, almost as fast, they seem okay again.
Mm-hmm.
Only for those same worrying signs to pop back up, maybe a week later, maybe a month. It's baffling. Confusing even for experienced owners, and, a real puzzle for new vet students, too. Okay, let's unpack this. Today we're doing a deep dive into a condition in dogs that gets called the Great Imitator.
Addison's disease.
That's the one. Medically, Hypoadrenocorticism. It's just such a master of disguise because the signs are, well, they're vague, they often come and go, they look like so many other things.
It's actually fascinating when you think about it. You have these two tiny glands right near the adrenals.
Yeah.
But they play this huge, almost disproportionate role in a dog's health, just their basic ability to cope with everyday life. And the core problem in Addison's is that these glands aren't making enough of some really vital hormones.
Which one specifically?
We're mainly talking about cortisol. People often call it the stress hormone, and another one called aldosterone. Aldosterone is key for managing the body's fluid and electrolytes.
Okay, so our mission here in this deep dive is really to simplify this whole thing for you. We want to give you the key insights, what the disease is, why it's so tricky to diagnose, and really importantly, how it's managed.
Yeah, the goal is for you to feel well-informed, maybe recognize those subtle hints, whether it's in your own dog or something you encounter as a student.
Right. So let's look behind the curtain at these adrenal glands. What exactly do they do? You mentioned two hormone groups.
That's right.
First, the glucocorticoids, like cortisol. You call it the general manager.
Sort of, yeah. It's involved in so much. Regulating metabolism, how the body uses sugar, fat, protein, helps with blood pressure, stimulating red blood cell production. It's even a natural anti-inflammatory.
Okay.
But a really crucial job is helping the body respond to stress, any kind of stress.
Like needing extra power. Like you said with the car analogy, needing fuel not just to cruise, but to suddenly accelerate.
Exactly like that. It gives the body that boost when needed. And then the other group is the mineralocorticoids, with aldosterone being the main one.
And those are the fluid and electrolyte managers.
Precisely. They fine-tune the sodium and potassium levels, and there's that basic principle. Where sodium goes, water usually follows. So aldosterone is critical for keeping blood pressure, blood volume, and hydration right where they need to be.
So in Addison's, what happens?
In Addison's, the adrenal glands themselves get damaged. They just can't produce enough of these hormones, cortisol and aldosterone.
And without them?
The body loses its ability to adapt, even to minor stresses like, change in routine or maybe a loud noise. It becomes incredibly vulnerable. And this can lead to what we sometimes call a physiologic disaster.
What causes the damage usually?
The most common cause, we think, is the dog's own immune system mistakenly attacking the glands. Autoimmune.
Ah, okay.
Though much more rarely, you might see things like infections, cancer, or even side effects from certain medications involved.
It sounds pretty serious, but you mentioned it's not super common.
That's right. It's uncommon. Maybe around 1 in 1,000 dogs in the UK. Studies suggest something like 0.06% of dogs overall. But that rarity can actually make it harder to suspect initially.
Which brings us back to the Great Imitator.
Exactly. That's the heart of the diagnostic challenge. The signs are just so vague, so nonspecific. And the really tricky part, they often wax and wane.
Meaning they come and go.
Yes, over days, weeks, sometimes even months. So it's easy for everyone, owners and vets, to just think, oh, it's a minor upset, or maybe they ate something funny again.
It raises that question, doesn't it? Why does something so potentially serious present so subtly? Almost deceptively.
It really does.
It's that feeling owners get, my dog's just not right. So what are these common but elusive symptoms we should know about?
Well, lethargy is a big one, just a general lack of energy, seen in, over 77% of cases?
Yeah, a lot. And loss of appetite, vomiting, also really common. Nearly 3/4 of dogs show those.
Right. Then you have things like diarrhea, maybe in about 45%, weight loss in close to 30%. General weakness in about 1/4 of them.
You might also see them drinking and urinating more. And sometimes those weird intermittent shaking episodes or muscle tremors, about 45% have those too.
And because these symptoms overlap with so many other problems, Addison's gets mistaken for all sorts of things.
Like what?
Well, the vomiting and diarrhea often make people think of GI issues, like inflammatory bowel disease or just recurring stomach bugs.
Makes sense.
It can also really mimic kidney disease. The blood work might show elevated kidney values, electrolyte shifts. It looks like kidney failure at first glance.
How do you tell the difference then?
Often, a key clue is how well the dog responds to basic IV fluids. Addisonian dogs often improve dramatically with fluids, much more than you typically see with primary kidney failure.
Interesting. What else can it look like?
Sometimes we see severe low blood sugar, hypoglycemia. That can even cause seizures, which points you towards other things, maybe like a pancreatic tumor. And then there are even rarer presentations like megaesophagus and enlarged esophagus causing regurgitation, which can happen because of nerve issues related to the disease. It truly wears many masks.
Okay, so the vagueness is a huge challenge. But you mentioned it can get much worse, even life-threatening.
Yes. This is where things can escalate dramatically. We talk about an Addisonian crisis.
And studies show that's quite common at diagnosis.
Yep.
Like 76% need immediate hospital care.
That's right. An Addisonian crisis is a genuine, full-blown veterinary emergency. The signs are sudden, they're severe.
What does that look like?
You see profound weakness, sometimes outright collapse. Severe vomiting and diarrhea, often bloody, extreme lethargy, trembling, maybe signs of abdominal pain, pale gums.
Sounds awful.
Their heart rate can become dangerously slow. That's called bradycardia. Breathing might be slow. They can even lose consciousness.
And what's happening inside the body during this crisis?
Essentially, the body has completely lost its ability to cope with stress. It goes into a state of shock, blood sugar plummets, severe dehydration sets in, and you get critical electrolyte imbalances.
Especially the potassium.
Especially the potassium, yes. It can get dangerously high, which directly affects the heart's rhythm. It can even cause the heart to stop. It's a stark fact that around 30% of dogs with Addisons are only diagnosed when they present in this kind of crisis state.
That's scary. So are certain dogs more likely to get this? You mentioned age and maybe sex.
Yes. While any dog can get it, we tend to see it more in young to middle-aged adults. The average age at diagnosis is around 5 years old. Dogs between 4 and 9 seem to have about double the risk compared to younger dogs.
Yeah. And females more than males.
Females are diagnosed somewhat more commonly than males, yes.
And what about breeds? Are there specific breeds we should be more aware of?
Absolutely. There's a definite genetic link for some breeds.
Like standard poodles. I read they have a much higher risk.
Significantly higher, yes. Some studies put their odds at over 50 times that of crossbreeds. It's quite striking.
Wow. Any others?
Yeah, there's a list. Labradoodles also show increased risk. West Highland White Terriers, Great Danes, Bearded Collies, Portuguese Water Dogs, Nova Scotia Duck-tolling Retrievers, Leonbergers, Rottweilers, soft-coated Wheaten Terriers. Quite a few.
That's interesting. But Labradors themselves seem lower risk.
That's what the data suggests, yes. Labrador Retrievers appear less prone compared to some of these others.
And this breed connection kind of points back to that immune system theory, doesn't it? A genetic tendency for the body to attack its own adrenal glands.
It strongly suggests that, yes, a genetic component making them more susceptible.
Okay, so given how sneaky this all is, how does a vet actually figure it out? They must have to keep it on their radar for lots of generally unwell dogs.
You definitely have to maintain a high index of suspicion, especially with those vague waxing and waning signs. It's like putting together a puzzle.
What are the first pieces of that puzzle, the initial tests?
We usually start with basic blood work and a urinalysis. These give us the first clues. We might see things like mild anemia, or a really telling sign is the white blood cell count.
What's unusual about it?
It's often the lack of something we expect. Normally, a stressed or sick dog shows a specific pattern, a stress leukogram, but Addisonian dogs can't make cortisol, the stress hormone.
So they don't show that stress pattern even though they're sick.
Exactly. The absence of that expected stress pattern is actually a big red flag for Addisons. We also look for dehydration markers and, crucially, those electrolyte changes, high potassium and low sodium.
You mentioned a ratio.
Yes, the sodium to potassium ratio. If that ratio drops below 27, it's highly suggestive of Addisons because it points directly to that lack of aldosterone. We might also see low blood sugar, or those kidney values that look high, but then improve dramatically just with IV fluids. That improvement with fluids is key.
So those initial tests give you strong suspicions, but what confirms it?
The definitive test, the gold standard, is the ACTH stimulation test.
How does that work?
It's straightforward. First, we draw a blood sample to get a baseline cortisol level. Then we inject a synthetic version of ACTH, that's the hormone from the pituitary gland that normally tells the adrenals to pump out cortisol.
Okay.
Then we wait an hour and draw blood again to measure the cortisol level after the stimulation.
And in an Addison's dog?
In a dog with Addisons, their damaged adrenal glands just can't respond. The cortisol level barely rises or doesn't rise at all. We sometimes call it a flatline result. That confirms the glands aren't working properly.
Is it always that clear cut?
Mostly, yes. A single baseline cortisol check can sometimes help rule out Addisons if the level is high enough. But if it's low or borderline, you still absolutely need the ACTH Stim test to confirm. And we should mention, there are variations like atypical Addisons, where initially only cortisol is low and electrolytes are normal, or secondary Addisons involving the pituitary. The ACTH Stim test is crucial for sorting those out too.
Right. Okay, so diagnosis is possible, even if tricky. What's the outlook then? Is it treatable?
Oh, absolutely. And this is the really good news. Once diagnosed, Addison's disease is very treatable. Dogs can live full, normal, happy lives, even if they had a severe crisis initially.
But it's a lifelong thing.
It is. It requires lifelong commitment and medication from the owner, but it's definitely manageable.
How is it treated? Let's start with that crisis situation.
Right, the emergency. That requires immediate hospitalization. The priorities are aggressive intravenous fluids to combat shock and dehydration, IV medications to protect the heart from that high potassium, and giving fast-acting glucocorticoids like dexamethasone usually.
And that won't mess up the diagnostic test?
Correct. Dexamethasone is usually chosen because it doesn't interfere with the ACTH stimulation test results if it hasn't been done yet.
Okay, so that's the emergency. What about long-term management?
Long-term, the goal is simple. Replace the hormones the body isn't making. There are basically two main approaches.
What are they?
One is a monthly injection. It's a long-acting medication called DOCP, which replaces the aldosterone, the mineralocorticoid. Dogs getting this injection usually also need a daily low dose of an oral glucocorticoid, like prednisone.
Can owners give those injections?
Yes, many owners learn to give the DOCP injections at home. It works out about every 25 days or so, depending on the dog.
And the other option?
The other option is a daily oral medication called fludrocortisone. This one is convenient because it actually has both mineralocorticoid activity, like aldosterone, and some glucocorticoid activity, like cortisol.
So maybe just one pill a day?
Sometimes once or twice a day. Though some dogs on fludrocortisone might still need a little extra prednisone, especially during times of stress. The vet works out the best plan for each individual dog.
So it sounds like there's ongoing monitoring involved. It's not just get the diagnosis, get the pills, is it?
Definitely not. Especially in that first month or so after diagnosis, dosage adjustments are really crucial. It means fairly frequent vet visits initially.
Why is that?
To fine-tune the medication doses. We monitor their clinical signs, how they're eating, their energy levels, and we recheck their blood electrolyte levels regularly to make sure they're in the right range.
And I guess it's critical owners stick to the plan.
Absolutely vital. Owners should never adjust the dose or stop the medication without talking to their vet first. Doing that could easily trigger another Addisonian crisis.
But with that careful management.
With proper treatment and that owner commitment, these dogs generally do incredibly well. They can usually eat their normal food, run, play, enjoy life, basically live a normal lifespan.
That's fantastic news. Yeah. You mentioned stress earlier. Since these dogs can't make extra cortisol for stressful situations, how do owners manage that?
That's a key part of living with an Addisonian dog. Owners become really good at managing stress for their pet.
What does that involve?
Trying to minimize stressful events when possible, like keeping routines consistent, maintaining a stable diet, but also being prepared for unavoidable stressors, things like vet visits, grooming, travel, maybe boarding, or even if the dog gets another unrelated illness.
What do they do then?
In those situations, the vet will often advise temporarily increasing the daily steroid dose, the prednisone, usually to help the dog's body cope, simulating that natural stress response they can no longer produce on their own.
Okay, so prevention of the disease itself isn't really possible because it's often immune-related or genetic.
Generally, no. We can't prevent the disease from developing.
But preventing a crisis is achievable.
Completely achievable. That's all about consistent medication, sticking to the schedule, regular vet checkups for monitoring, and just having really open communication with the veterinary team. If anything seems off, call the vet.
So when you think about Addison's disease, what really stands out to you?
For me, I think it's that contrast. The subtle, almost hidden nature of the disease in its early stages compared to the potential severity of a crisis. And then the incredible resilience these dogs show once they get the treatment they need. It's very rewarding to manage these cases.
Yeah, I agree. It really underlines how important it is for owners, for you listening, to just be observant. Notice those small, maybe recurring changes in your dog's health or behavior and not dismiss them.
Definitely. And ultimately, this deep dive, the information we've shared, it's about empowering you, giving you the knowledge to be a proactive owner or an informed student so you can ask the right questions and work effectively with your vet.
Absolutely. And just that crucial reminder, this discussion provides general educational information about Addison's disease in dogs. It is absolutely not a substitute for professional veterinary advice or care.
That's right. Always, always consult a certified veterinarian for any concerns about your pet's health. They're the only ones who can provide an accurate diagnosis, recommend the right treatment, and give you that personalized advice.